today's video, I'm going to talk about ankle pain, different types of ankle pain, how to tell which type you have, and how structural integration would address ankle pain. Now, there are many different types of ankle pain, but there are, I'd say, three predominant ones. The first one is pain on the sides of the ankle. Usually, people have pain on the outer malleolus or somewhere in the foot just below the ankle, or in the ankle joint itself. That's the most common. The second most common would be pain in the front of the ankle, perhaps even deep into the joint, and stiffness in the ankle. Both of those will usually have some kind of stiffness in the ankle, lack of range of motion and flexibility. The third type of ankle-related pain would be pain in the Achilles tendon, whether it's on the bottom of the foot where the tendon attaches, or whether it's in the meat of the tendon or up into the calf muscle where the tendon eventually goes into the muscle. All of those things can be addressed well with structural integration, and in my experience, they're almost all related to some type of muscular imbalance. Now, if there is a muscular imbalance, there very likely has been some type of injury as well. So for many people who are chronic ankle sprainers or who've broken bones in their leg or foot or whatever, doing sports or in some kind of traumatic injury incidents, the tissue is going to be all reinforced. So what structural integration does is it frees up and it starts to balance out the tension between the inner and the outer leg, the front and the back of the leg. And the tensional imbalance is usually where the problem lies. If you've got pain in an area from chronic injury, the reason for the chronic injury is the imbalance. When you remove the imbalance, the injuries stop happening and your body's able to heal what's injured. For example, my wife, who is an avid volleyball player and rower, for many years was a chronic ankle sprainer. In fact, she would stand, there was one time I remember she was standing in front of me, we were standing on a sidewalk, and all of a sudden she fell over. She had sprained her ankle just standing there. That's how bad it was. Once I learned this technique and I practiced on her regularly, why then she hasn't sprained an ankle in over 10 years. It just goes away because now her legs are balanced. They're not completely balanced, but they're balanced enough that it doesn't happen. And that's all you need. Balanced enough. So, the first session of structural integration starts to address this, not directly. If you come into my office and your primary complaint is an ankle problem, I will work there the first session. Where this is really rigorously addressed is the second session of structural integration, where we focus on your feet and legs almost exclusively. And that is balancing and rebalancing. Now say from session 1 to session 5, we're working on legs and feet for most of those sessions. But there are other sessions in the series that we work on them as well or have opportunities to. So, that said, without having to commit to the 10-session series or even in your mind think about committing to the 10-session series to resolve an ankle problem, I suggest that you come in and try a session. Try one. Try one session, see if you don't feel a difference, and if you do, why then it might make sense to you to do the rest of them.